Hi, I'm Dr. Lakshmi, an ENT surgeon from Chess ENT Chennai. Have you ever had a second step? Have you ever thought of getting a second step? Well, there are some things you need to know before you get one. In this video, let's discuss about things you need to know before getting a piercing, how to care for your piercing, what are the warning signs if at all you're going in for an infection, and when to seek help. Things to know before piercing. Number one, always know extra piercings are associated with potential risk. For example, in the cartilaginous part of the ear, eyebrows, tongue, belly button, all these are associated with risk factors. Number two, you've decided to get a piercing. Now, how to go about it? The best thing is you find out a qualified person who can do it for you under aseptic precautions and not one of those random spas or tattoo places. Ask your doctor if you are a potential risk candidate for piercing. For example, if you're a diabetic, an immunocompromised person, or somebody who's on a blood thinner for a cardiac condition. These people are at a higher risk. Also ask your doctor what is the normal course of healing, how long would it normally take, or what are the warning signs to pick up, if at all, to seek medical help. So these are the things you need to know before you do a piercing. Now, once you've done a piercing, you should know how to care for your piercing. So, number one, clean your piercing twice a day using gauze soaked in warm saline or salt water. And once you do that, the crust around the jewelry will soften. So, remove the crust only after it is soft, otherwise, it will bleed. Now, the third thing is you can twist the jewelry slightly using a Q-tip. Twist it so that the tract is found well. And once you're done cleaning with water, make sure you dry mop all the water off the area using a clean, dry tissue. And most importantly, apply that antibiotic cream that your doctor has given you, lest you catch an infection. Now, things to avoid when it comes to a piercing. Don't ever do your own piercing, or for that matter, your brother or sister doing it for you under unsterile circumstances. Bad idea. That is directly introducing infection into your skin. Number two, do not pick on those dry crusts. You will be very tempted to, but no, don't do that. And number three, which is very, very important, no matter how tempted you are, don't go for a dip in the pool right after you had a piercing. It is direct inoculation of infection into the skin. So wait on it, maybe for a couple of days after you had a piercing. Why do you think doctors caution you about these extra piercings in the ear? It's because the infection in the cartilaginous part of the ear can result in what is called perichondritis of the pinna, and otherwise inflammation of the pinna, which upon healing or scarring will result in what is called a cauliflower ear. In worst cases, you can even develop facial cellulitis or necrotizing fasciitis of the ear. These are all quite permanent conditions. Just for a matter of trying to look good with an extra piercing, you'll end up with a horrible looking ear. Well, that's not a good cost to pay. This is the reason why we caution you about that extra piercing. Now, how do you know that you're going to it? Or rather, you're going to develop it? You should know the signs or red flags to pick it up. Number one, your ear will be excruciatingly painful, swollen, red, sometimes even black if it's quite bad. Blood or pus may ooze out of it. If it has gone systemic, then you might develop a fever also. These are the conditions in which you have to seek immediate medical help. Ear piercings or extra piercings. With this case of ours, a 36-year-old lady had her ear pierced at the upper end of the helical cartilage, that is this part of the ear. Alright. After 2 days, her son pulled at it. Now, it had some sort of discomfort and some pain, for which she didn't really pay any attention to. And a few days later, she developed swelling, for which she took 1 or 2 doses of analgesics. That was all. No medical help was sought. And by the end of a week, she presented with this kind of a picture. Any sensible doctor would know that it has passed the stage of perichondritis and has become an abscess on the pinna. An abscess on the pinna is I would say one of the last things you should have. Even though we were able to drain it, remove all that necrosed cartilage, do daily dressing, start give her IV antibiotics. Still, at the end of everything, this is how she healed. You can see the contour of the ear is completely lost. The upper contour is totally lost, and there is scarring. There's change of color. So this is not reversible. You see, if you ask me, unless you do an autoplasty, which is too much. So, just to look good with an extra piercing, this is not the cost that you should pay. So, let me tell you once again that before you get a piercing in the cartilaginous part of the ear, for that matter, any extra piercings that you get, think twice before you get it. Follow all the precautions that we discussed, and make sure you don't land up in this kind of a situation. So, that's all. Thank you.